Niacin, traditionally recognized for its lipid-lowering effects, reveals in this study a far more nuanced and powerful role in cellular metabolism and cardiovascular protection, particularly through its impact on lysosomal calcium signaling and cholesterol trafficking. Rather than simply modulating serum lipid profiles, niacin engages in intracellular regulation that significantly alters the course of atherosclerosis development, offering a broader and more dynamic view of its therapeutic potential. At the core of this mechanism is the stimulation of lysosomal calcium channels, notably TRPML1, through a cascade initiated by niacin-induced upregulation of CD38. CD38 catalyzes the production of NADP, a potent second messenger that mobilizes calcium from lysosomal stores. This calcium release is not merely a byproduct of signaling, but plays a central role in enabling the cellular machinery to export free cholesterol from lysosomes, critical for preventing foam cell formation and inflammatory signaling within atherosclerotic plaques. Niacin's ability to enhance lysosomal calcium signaling via NADP appears to orchestrate a series of coordinated events that improve cholesterol efflux. It promotes the expression of liver X receptor alpha, LXRA, which then upregulates essential transporters like Niemann-Pick type C1, NPC1, ABCA1, and ABCG1. These proteins collectively ensure that cholesterol trapped within lysosomes is effectively exported, either into the cytoplasm for further metabolism or across the plasma membrane for removal via reverse cholesterol transport. This mechanistic pathway not only clarifies how niacin contributes to plaque stabilization and regression, but also underscores its anti-inflammatory potential. By preventing lysosomal cholesterol accumulation, a known trigger for inflammasome activation, niacin indirectly inhibits the secretion of pro-inflammatory cytokines like IL-1SET. This anti-inflammatory action, coupled with improved cholesterol trafficking, helps reduce macrophage apoptosis and necrotic core formation in plaques, further supporting vascular integrity. Importantly, these effects are independent of systemic cholesterol levels. Niacin-treated animals showed significant reductions in atherosclerotic lesions despite unchanged plasma cholesterol, suggesting that its benefits stem largely from intracellular lipid handling rather than circulating lipid concentrations. This shifts the paradigm. Niacin is not just a systemic lipid drug, but a modulator of cellular lipid homeostasis and lysosomal function. Moreover, niacin's impact on cholesterol handling is highly specific. While it effectively reduces lysosomal free cholesterol, it does not significantly alter the levels of cytosolic cholesterol esters or lipid droplets. This selectivity is promising because it implies niacin may avoid the complications of altering neutral lipid storage while still addressing the more pathogenic unesterified cholesterol pools that drive inflammation and cell death. What emerges from these findings is a more optimistic and comprehensive perspective on niacin. Rather than being an antiquated drug eclipsed by newer lipid-lowering agents, niacin demonstrates a rejuvenated relevance, particularly for patients with lysosomal cholesterol handling defects or chronic inflammatory states underlying cardiovascular disease. Its ability to engage deeply with intracellular pathways, especially through calcium-dependent signaling and transcriptional regulation, offers opportunities for combination therapy and targeted intervention where conventional statins or PCSK9 inhibitors may fall short. In sum, niacin does far more than tweak numbers on a lipid panel. It activates a chain of protective cellular processes that reduce cholesterol burden, quench inflammation, and preserve macrophage viability. These findings not only reinforce niacin's role in cardiovascular therapy, but suggest that we have only begun to tap into its full pharmacological potential, especially as a modulator of lysosomal health and intracellular trafficking systems.